Good morning, and welcome to another wonderful session from our conference. I'd like to introduce to you Eugenia Montesinos. Eugenia is a certified nurse midwife who was born and raised in Peru, where she began her professional career as a veterinarian and worked there for many years. She has a unique path to midwifery. Her passion for midwifery was sparked after experiencing her pregnancy and labor with the support of a midwife. After changing careers, she has been a midwife since 2000. Since then, she has been working in Manhattan and Brooklyn, mostly in city hospitals that serve Black, Indigenous, and people of color, as well as immigrant populations. Join me in welcoming Eugenia Montesinos.
Good morning, everyone. Again, my name is Eugenia Montesinos. I am a midwife for the past 20 years in New York City in an inner hospital. And it's been an honor to participate in this event. And I am gonna I'm gonna share my screen and bear with me 1 second. And I'm gonna go with that, okay. So what I'm gonna do today, I'm gonna talk about who are the midwives, where they are, since the beginning of what midwifery started in this country to the current times. And I'm gonna start by saying, what is a midwife? Midwife actually means with women. And since the ancient times, woman was delegated to take care of a woman, not only in childbirth, but also during her life, and also to the community. And actually, midwives took care of midwifery to all the community when medicine did not exist. They were the healers of the community, and they use herbs, they use plants, they use home-based remedies, and they cure all those illnesses that were happening at that time. So it was, as I said, an ancient profession. There was usually an older woman, and there was a wiser, and there was an advisor, and they passed this knowledge from generation to generation, or to any other woman who had that inner calling to take care of another woman. And so that was a midwife. So it was existed since ancient times, and actually way before when life existed. Midwifery already existed at that time. It was in the Greeks and the Romans and all those times. Even in the Bible times, we can see that midwives existed. And so, and now I'm gonna be going, while I was doing my research, I searched when was the first child, the white child born in United States. And I went upon to Virginia there. So there was a child who was born in Roanoke Island in the Virginian colony. And it was a big event. As you can see here, they even made it a postage in celebration of this big event that happened. And then I went to research when was the first Black child was born, because we know that when at the time that the Europeans came, they brought the slaves. So with the slaves, they also brought midwives and Black midwives, and yet they were attended by Black midwives. And this community, we had the very first Black child in 1619. And I put here another date of 1624, because when I did a little research, I found out that in 1624, this child was baptized, and therefore I guess it was legal. So then we're gonna be going when the Pilgrims came in 1960 in the Mayflower, and Bridget Fuller was a British midwife, an educated midwife that it came along in that in the Mayflower. And I put it a little, I'm putting an emphasis in here because midwifery in Europe started much, much earlier, not the education and the licensing, it started much earlier. So already existed, so Mayflower brought their own midwife. So here, what I'm gonna be going, and this very first part of this presentation, so I'm gonna go over about the timeline of midwifery and relation of the evolution of medicine and how medicalization of childbirth played an important role in the decimation of midwifery to these days. So actually, in my opinion, what I think it was mostly because the medical people, they were more in monetary gains, and also they had a misogynistic approach to midwifery and in medicine. I mean, and medicine in this country started since the very, very beginning and more about monetary gain. And why I say misogynistic, because men at that time, they thought that women were less intelligent and were less than a man, and they couldn't be educated. They were only good for house chores. But the irony of this part is that for me, that when medicine was not discovered, midwives were be taking care of the communities. She was the one actually that people relied on. So that is part for me, that when I think about it. And here in 1716 in New York City already require to be midwives, be licensed. And again, they were already starting to put some, make it hard and medicalizing that part already. And by 1765, this Dr. William Shippen opened the very first midwifery school with the idea to educate these women. But at that time, women could not go to school, it was unaffordable, and they couldn't do it. So soon after 2 years, this school disappeared. By 1948, the Medicalization Association formed standards of practice. And these standards of practice were implemented with the idea also of already eliminating midwives, that they should be, childbirth should be happening only in hospitals. They were already starting to go into trying to eliminate midwives. So by 1900s, physicians already were starting to attend most, the 5% in the hospital births. And by 1902, this Dr. Joseph Lee make a big statement about childbirth was a pathological event, something that they needed to be taken care by doctors. And at the same time, sedation and episiotomies were implemented at that, because what happened when women were sedated, that they couldn't do, they couldn't push, and also they were not trained really, and they thought that opening and cutting an episiotomy will be much faster and a way to be doing it, which with midwives did not exist, that part. And so that happened there. And by 1911, in New York City, founded a very health, public health program at Bellevue Hospital. And again, this one was with the purpose of gradually eliminate the granny midwives, all and replaced with certified midwives. So that was that. In 1915, in New York City, the medical culture had a big influence to gear maternal care as a public health matter. And as more immigrants were arriving to communities, so more communities of immigrants happened, and poverty levels were high, because as you immigrate to another country, usually at the very beginning, it's hard and you don't have money, and you stay in poor areas, not because they don't have means, because of the economy and them, until they adjust to the country. So in that time, in the immigration time, when the Italians came, they brought their midwives. When the Jews came, they brought their midwives. When the Irish came, they brought the midwives, because in every culture existed a midwives. And it was a good, in all these areas were attended by midwives. But one of the things that they were looking into is because the maternal care at that time was having poor outcomes, not because the skill of the midwives, it was just because the poverty levels. And sometimes in at homes they were sharing families that there was no water, or the ways of living was a little poor, as I said, in poor areas, and that was influence in terms of maternal care. So in 1915, that is when they formed the Maternity Center Association. It was a nonprofit voluntary health agency based in Manhattan to cover all these immigrant areas. They divided in 10 districts, and that is how they went. They went to take care of maternal care. And by 1920, already 50% of births were happening in hospitals. And by 1921, Mary Breckinridge first opened up the very first school in Kentucky, the Frontier Nursing Services. And interesting enough, Mary was a very well-educated woman, and came from a prominent family. In fact, her father was the vice president of President Buchanan. Later on, he became ambassador in Russia, and while in there, Mary had witnessed the born of their brother under the Russian midwives, and that impressed her a lot about the maternal care. And later on, she moved to New York again, and after she got married and lost 2 children, she went to school and became a nurse. And she became a nurse with more emphasis in public health, and she joined the Red Cross, and she went to practice and learn more in France. And while she was in France, actually, she was working with French midwives, and she learned a lot about maternal care, and that cemented even more her emphasis in maternal care. And that is why when she came back to United States and she settled in Kentucky, not because she chose that area, it's because in Kentucky she had family members in there. And so she moved there and she saw how maternal care was in that poor areas, and she decided to open up the very first midwifery school. Later on in 1931, it was formed the Lowenstein First Nurse Midwifery School, which she had a lot of influence in that because she was already a nurse, and she thought that midwives should be educated as a nurse midwifery school. So that was the very first nurse midwifery school in the nation in New York City, and later on became the Columbia University School, which was a very oldest school in nurse midwifery. By 1935, we can see already all the births were attended by physicians. So in one other team, by 1938, the twilight sleep came. And that what was that twilight sleep was a combination of morphine with the scopolamine, and they gave to all the mothers, and they used it in all of them. And what happened with that? Because mothers were all fall asleep, a lot of forceps were used because mothers couldn't push, they couldn't even remember that they had the babies. And it was completely medicalized by then. And by 1948, the midwives were completely almost wiped out. Yes, 5% they were attended by midwives, and the rest were already hospitalized, in hospitals. And in 1955, that is when they formed the American College of Nurse Midwives was formed. And by 1970, this American College of Midwives came on with the standards of practice and the certification of nurse midwives, and mainly to work in educated and only to work in hospitals. So, and by the 60s and the 70s, women started to claim the natural ways of childbirth, because they were saying it is crazy to be not remembering that you have a child, and how invasive was using forceps and all that. And they wanted to just have in a natural way. And also it was an era of the women's rights. It was a big movement about that. And that was the hippie years, and a communal way of living. So in Stephen and Ina May Gaskin, they formed in the farm, and they started in there. And that is where Ina started to attend birds, and that was a big influence to regain the midwifery in community, and not should be not happening in hospital. It should be happening in communities and at homes. And she published a very well-known book. Is called The Spiritual Midwifery, that influenced a lot, that more midwives that were more interested to be having and attending births at home. And that one it was a big thing for the community of midwifery, and as I said, to regain those skills. At the same time, by then, only 1% of births were happening with midwives, and 99% were in the hospitals, that completely medicalized. And because of this moment, what was happening in 1982, the Midwives Alliance of North America happened, and because it was a movement, and they got together certified midwives and certified midwives, and also midwives that were trained by INA, and some other midwives that they were trained in a way that apprenticeship was learning. So they got together and they formed this a big alliance in response to be this medicalized midwifery, and this one was a different approach. And later on, they formed what is called the National Association of Childbearing Centers. So that soon became the American Association of Birth Centers, which was another form and another option to be having a baby and having in a more home-like environment, and another option that happened. So to this day, that is how we are having birth centers, we having home, and we having with a majority still in the hospitals. So now I'm gonna go back a little bit about what happened with the Black midwives, why I'm talking about this, because we having about a big high mortality rate in the Black community, and a lot of Black moms are dying to the point that it's 3 to 1. So I reviewed a little bit about what happened with the midwifery, with the Black midwives. So Black midwives were brought here by the Europeans, and they, along with their slaves, they also choose midwives, slaves that they were very highly experienced in midwifery. So they bought it with the idea that they can pass their knowledge to the next generation, and also to attend their communities. And in fact, they became attending also their owners. They were not only the servants, but they were child care, childbirth, they did everything. And that is what had happened in there. So in midwives, the Black American midwives, it was a big community, and they were, you know, in the 17th century all the way to the mid 20th century, they had a vast community of Black midwives that were very well known, Black, you know, the granny midwives, which were very skillful midwives. And they had a lot of knowledge. And so they attended births in their community as well as their own, as I said. But at the same time, what happened that medicine was advancing, and the upper class women, they wanted to be attended by doctors, and doctors also play an important role in this, how to disappear these midwives. So what they did is they, as the medical, as I said, was advancing, the Black midwifery started to be decreasing because they were attacked with aggressive legislations and racist propaganda that saying that these women were dirty and uneducated, they were poor, and truly it was a vicious racist propaganda that they did. And again, the midwifery, I mean, the medical model is mostly about what they were making money about that. So they did purposely about that too. And they, so these physicians put more rules about having an oversight. And also they made it hard for them, the cost to be getting licensing and all those regulations they put it on them, they made it very hard for them to be more licensed and educated. And plus they made it very hard, another thing that it happened, they made it very hard that for them to keep practicing, and they made it that every childbirth should be happening in hospitals, not at homes. So even though these Black communities, they kept attending to their community, because remember it was a segregated community, and those Black midwives kept attending their community, and that was that. And another thing that happened with the disappearance of the Black midwives was the emergency of public health nurses. They they made it more, they had more public health nurses that were going to these communities. And another that influence that happened, they started to educate nurse midwives. So these nurse midwives can be working in the hospital. So little by little, the community to very skillful Black midwives was lost, which was very sad. And here we see already a very well-known movie about the skillful midwives, the Black midwives here in the community. So that was what we got to this point, that we lost a very good, skillful Black midwives. So now we're gonna be going to the point that what people think about midwives. So when they ask a lot of people, since they were already brainwashed by this propaganda against midwives, people now think about, when you said what is a midwife, they said, oh, they think immediately. They are thinking about that they are uneducated and they don't know, uneducated in health practices that only do home births. Or some of them, they said, oh, it's the hippie era. And or some other people, they think it's only for the rural areas. And other people, they think, oh, it's a thing of a past that existed. And again, they are immediately related to the uneducated midwife. And lately, what is another thing that is happening? They think immediately saying, oh, doula. So they have that because the doula movement happening at the same time now lately, and people immediately think that a midwife is a doula. So that is that. So that takes me now, what really is midwife these days? The majority of the midwives are like midwives are independent practitioners that they provide healthcare, not only maternity, gynecologically, reproductive care, contraception, and in a sense, they are a primary care provider for a woman. And they attend from adolescent all the way to postmenopausal, and also on infants up to 20 days of age. One of the hallmarks of this of the midwifery is they are holistic and comprehensive and respected approach that we have is care in partnership with the woman. It's not telling you to the woman, it's just a more individualized care woman that is given by the midwife. And currently, also now these certified nurse midwives that expanded their care, and now they are attending to transgender people too. So that takes us about what types of midwives you're going to find in the United States. Now we have the certified nurse midwives, we have a certified midwives, and we have the certified professional midwives. And we have a tiny small part of other kind of midwives that they don't being certified, they just learn about apprenticeship, and but there's very, very small numbers of that still exist. And so I'm gonna go over about these types of midwives and see what is the difference. So here we go. So what are certified nurse midwives? Certified midwives, they are mostly midwives that are educated at the graduate level and universities. And they are licensed in all the states. And they mostly work in hospitals and some birthing centers, but the majority they practice in hospitals. And in fact, it's a good, like a 95%. They work in that, and lately they're working more in home births now too. It's starting to grow that. So one of the things that about midwives, they have also prescriptive privileges, meaning they can prescribe anything to a woman, from regular antibiotics to things that were contraception and all that kind of medication that it can go, because they are like a primary doctor for a woman, and that is who they are. And they are, as I said, what is the difference here when I say certified and certified midwife? The difference among both of them are that the certified midwife is not a nurse, but the education level and the tests and the licensing is rigorous, the same as to a certified nurse midwife. And actually that is my case. I became a nurse to become a certified nurse midwife, not because I want to be, or I work as a nurse. I never work as a nurse, but yet I am a certified nurse midwife, that I needed to become a nurse in order to become a midwife. But that thing had changed, and more schools are now opening and having what we call direct entry without being a nurse. And these midwives are working legally in 10 states. Why I say that, or legally, it's because the lack of knowledge that some states they have, that they require a nursing. So that is that. And so far it's starting to already change in different states. At the very beginning, it was just 3 states, New York, New Jersey. And now we already have 10 states, and slowly this is changing. And the number of midwives here in United States as of 2019 are 12,000, and by now are around 15,000 midwives. And here is a map where you can find a midwife and what states that is still requiring the supervision of doctors. Here, highlighted in red, you can see there that those states are still requiring the supervision of MDs, of doctors, even though midwives are independent professionals. So now we're going to be going about what is a certified professional midwife. And certified professional midwives are you don't have to be a nurse, first of all, to be educated for that. And in fact, you can be as having a high school and be trained as certified professional midwife. They do get a very rigorous training and very rigorous enhanced skills also. And they don't have to go to traineeship to hospitals like the certified nurse midwives go. And they mostly work in home and birth centers. And one of the things also they can't prescribe. They can do it on the prescription during prenatal and also while attending a birth and also postpartumly. So that is one of the differences. And also they can, as I said, they can't work in hospitals. They are being licensed in 35 states, and New York is one of them going and in the works. So slowly also they are growing, and they go into different states, and we're gonna need midwives. We're gonna need not only certified midwives and certified professional midwives. We're gonna need in this country, and that is one of the things that it's growing. And that is that. So now we're going to be going about where you can find a midwife. And so according to what a woman is looking for is where you can try to find a midwife. Either you want to have a baby in hospital, or you want to have a baby in the birth center, or you want to have at home. So that is one of the things when you are looking, that is one of the things that you can look for. And also, where do you live? Do you live in rural areas? Do you live in urban areas? And in rural areas, it's a little even harder to look for more options as opposed in urban areas. Another thing is also about health insurance, and some health insurance cover midwifery care, including certified professional care, meaning by CPMs. And that is that. And also another thing is about what is your knowledge about midwives, what you know about knowledge, and what kind of midwives you wanted, what the scope of practice the midwife have. And as I said, if it's in rural area by CPM, you are gonna have just during prenatal, childbirth, and postpartum. And you're still gonna need your primary care provider. So now it takes you to why midwives are important here. What is that? We are having a crisis in maternal health right now. We're having an increased mortality rate in Black mothers. They're dying 3 times more likely in childbirth than white. And we have a medicalization approach. And even though we have midwives working in hospitals, they are trying to do a home-like approach, but yet it's we're not there yet. So that is why it's important, and very few hospitals have midwives, and the implementation will change. That is why I think is very important. And also one other thing is lack of comprehensive and evidence-based care that happen in hospitals. And why I say comprehensive, because when midwives is there, it gives an individualized care. It's not only about what is going on in your pregnancy right now, but also what is socially, what is happening with her, what are social issues that are affecting you in your pregnancy, and like living conditions, single motherhood, or any kind of mental health issues. So it's a little more a different approach that happening. So that is why midwives are important to be working in health in hospitals. And another thing is also lack of cultural competent maternal health providers. Very few. I am one of those few brown midwives. I am a Latina, and it makes a difference when you give an attention, because if you have a healthcare provider that looks like you, it's much easier to talk about issues that are happening with you, and also that provider can understand about culturally what is going on, and not only about how they look, and also is how practices and beliefs that happen in certain cultures. And like for me, for example, if I have to talk about nutrition, I'm gonna know exactly what she eats, what unlike I'm gonna be to a woman, I'm not gonna be thinking about that she only eats tacos. So it is a lot of different. That is what we need. We need to be culturally competent providers that it will be, as I said, for me, I think it is more, it should be look like you also. And we should be having a number of providers that reflect the people that we are representing. And one other thing that what I put in here about expanding postpartum care, it's that why midwifery, because when you're having a child with midwife, it's not that you end it once you have the baby, you end it and you say, see you later, I'll see you in 4 or 6 weeks at your postpartum visit. And when it's with the expanded care, you with midwives, you focus in what else is happening with this woman when she's going home, if she's going, if she's gonna have a support person, if she's gonna be a single mother, and all those things are triggers for postpartum depression. So midwives have a slightly different approach. Not, I wouldn't say it's slightly, a big difference in the way how we approach the childbirth and postpartum care, and in general women care. Another thing why I put here about childbirth cost. We pay so much money for having a baby in a hospital, and yet we have poor outcomes. And midwifery should be implemented, and not only in hospitals, also at home and birthing centers, and all that thing will be much lower cost, and we will have a better outcomes, and our mothers will be much happier, our families will be much happier, and will be decreasing the numbers of C-sections, decreasing the numbers of prematurity, that all that costs a lot of money. And that is super important that midwifery should be in there. So now we're going to be going what happened with the responses about this maternal, Black maternal mortality, and what were the responses of the government. And so many Black mothers were dying, and the husbands got really upset about these things, losing their wives in childbirth, and so they got very involved in the movement of these ones, and they were seeing what was happening with the providers and hospitals. They don't believe that their wives having pain, and they thought that providers thinking that the pain that they feel is completely different than a white woman, and in fact pain is universal. And so they were depriving pain medication to them, and sometimes they were, because of the bias thinking, and they see them as a drug addicts, that they trying to look into get high in painkillers. So that was another biased thinking. And all these things caused an outrage in the community, in the Black community, and these partners. And so with the help of Black doulas and advocates and birth activists and also some midwives and some doctor allies, they work in this, and they put a very into these matters of the representatives, and they approach to the Black caucus, and the Black caucus responded more into all these things that they came to light now about maternal health. So in 2021, the maternal health bills came. I was introduced by them, actually, by the caucus, and were very important things that was highlighted. I'm putting here just a link so you can go over with that, and we're gonna touch a little bit later on. And one other thing that I'm gonna talk about, what was another response now that come to light, is that during the presidential campaign that Kamala Harris and Senator Cory Booker were running their presidential campaign in Black maternal health. And that one also had a lot of influence in coming to light what was happening with the Black maternal health. So that one, it's another response that was happening. And what other thing what happened now? And COVID-19 pandemic came to us. And that and made it even a clear view of racial disparities in healthcare. It was nothing that they couldn't avoid it to see it, because who were really affected, which communities were affected by that. COVID was ravenous for that people of color. So that takes us about what was midwifery in this time. And I am one of those. I was here in New York in the big epicenter, and we were scary times that we were having, and we were facing now all this pandemic that was attacking mostly in big, the community that was mostly affected was Queens. And why we saying Queens? Queens became the epicenter because Queens is one of the biggest district in New York that is the most immigrants from all over what happening. And again, with history, we know already when immigrants just arrive, their conditions of living are not the same as the ones who are here. They share apartments, they share, even two families share one apartment, and they share rooms and they share bathrooms and all that. So when the pandemic came, affected all these communities, and when one person in the house got infected, every single one got infected because of these conditions, because they were breathing the same air and they sharing the same bathroom, and all that, it was affected. And they are the more ones dying in big quantities, and that is that. Another thing that happened with the midwives, we had that a lot of our pregnant ladies, it was a big exodus of white mothers, pregnant mothers. Actually, they left the city, they left another states to have their babies. And that also made it another clear thing, that differences, that who got more affected, poor people of color stayed home and they couldn't go anywhere. They were staying in the city. And another thing that happened in New York was that white women and women that they have more meanings, more money, they were starting to look home birth midwives, that they could be attended in their homes. And so a lot of home birth midwives, they were demanded and they couldn't do it. They were out of capacity, because now everybody wanted to have a babies at home. So that happened at that. And another big thing that happened at that time, with all of you know already what was the pandemic that happened in New York. So in a couple of private hospitals, and doctors and providers got infected during labor. And that prompted to put a mandate that a woman should be coming along to have a baby. And which was very inhumane way, and to expect a woman being scared not only of the pandemic and also now in pain and having the baby in the middle of the pandemic. And that was scary times. And so that caused an outrage of a lot of activists, birth activists, and doulas and midwives who came. I was one of them participating in this movement. And we actually went to the governor and claiming that it's kind of barbaric to put a woman being under these conditions to have alone. So Governor Cuomo gave us rules in favor to at least have a partner in birth. So that changed, and hospitals were allowing to have a partner during birth. So that was that. And one of the things that came to light also, because all these things were happening, the media got involved and public got involved, and they were now knowing what is the need to have a midwife. Now it's more clear that hospitals are for illnesses and not for natural events, like having a child is not an illness. So those things prompted to make it very clear that why we needed midwives, because you can have it at home. And that is another thing that I got clear in midwifery in times of COVID. So here I just want to share a little pictures what is having a baby in a hospital in before the era of the COVID. We were at happy events and sharing and pictures and all that. It was happy events, but when COVID came, we were all covered, completely covered. Only our eyes would be seen, and we were gowns and all that. It was scary. It's scary for us. It's scary for the women, and it's scary for us to get infected. And yet, almost all of us got infected, and nurses, doctors, and midwives got infected. So this last picture is about nowadays that we still have happy times, and but with masks, and we are more COVID era. So here I'm gonna show you a little bit about home birth in New York City, and with certified nurse midwives and certified midwives, and not CPMs yet because they are not legal yet, and they are working on it, and we're gonna need it. So now I am gonna cover what happened with COVID and reproductive care. So when COVID happened and we could not get in touch with our moms, and we couldn't get in touch with our patients for reproductive care, we couldn't provide the contraception, and we didn't even know what they've been doing, how they've been doing. It was a complete disconnection with them, and they couldn't get in touch with us. We couldn't get in that, and it was harder times. And sometimes the women just completely disappear. They just arrive when she was about to have a baby. So that is what happened in there. And another thing that happened was an increase of unintended pregnancies because they couldn't get the contraception that they needed. And so it was a lack of contraception. One other thing that we saw, the increase in domestic violence, and that it was increased even more because women didn't know where to go. It was just you being in your home, and it was a desert. New York City was a scary ghost town, actually. So one other thing that happened with COVID and reproductive care is that unemployment happened, not only about the partners, also women lost their jobs. And actually who got more affected was poor people, people who got their jobs already that they can attend it from, do it online. You can attend it from home. But these put people that work in the food industry, or they work in cleaning industry or the hotel industry, all of that had lost their jobs, and that created a big impact in the economy of these poor people. And because of that also, the telehealth creation happened because of COVID, because since we could not get in touch with them, at least we could call them and find out how they were doing, what they were doing. So the telehealth was a creation due to the pandemic. So now we are at the current times. What is happening? What is the response of the maternal health and especially for the maternal health caucus? So Congressman women Alma Adams and Lauren Underwood, they launched the maternal health caucus just to address these more urgent issues that were happening in the crisis in the United States, with that so many maternal death that is happening in the Black women. So they got together with all the members of the Black Caucus, and they came up with a bill. It is called the Maternal Health Mominous Act bill, that it was cover many bills that it covered, mostly about what influenced these outcomes in maternal health. It was not only about attending the birth, it is what else was happening with that. It was the socio-economic determinants that contributed to this, and also what was happening, the perinatal force that they needed. They also thought about the pregnancy and postpartum care, and it should be implemented, because that is what they came up with, the idea to cover all the way to 12 months now for postpartum care. And before that, it was not. So this reinforced all the care that they should be expanded, because women were not dying only in childbirth, but the majority actually happened after, which was a postpartum and the postpartum period, which all the way to a year. So with that, they came out with those bills that it should be expanded all the way to 12 months. So I'm putting here a little more. I'm not going to go into every single bill with these titles, and I put the link here that you can go over and see that very important bills that happen to just tackle this part of maternal health. So now this takes us what is happening currently with President Biden and the Build Back Better Act. He put it also the Mominous Act investment, and it was very careful look at how to fix this crisis that is happening, and see, because not only it was about the racial disparities that is happening, and also what else is happening, what we needed. And we needed a birth equity, and we need to educate our providers. We need to be giving, so they can have a biased thinking. They should be looked upon on these things. And he invested a lot of money in this, and he in his bills, he put in here, I'm putting a highlight only here about the providers in healthcare and maternal care, meaning 290 millions that he put just to increase the number of the health force for nurses, for midwives, for physicians and doulas, and including the maternal health and behavioral health in maternal care. And he actually included an extra 50 million to specifically for midwives, for doulas. So I am putting here the link about that, all the money that he put for maternal care, because it's not only about training people, and it's also about the develop of maternal health tools on how to get representing of the community involvement, so more money to be in the community involved, and all the maternal mental health, and all those things are in there in the link that I put, so you can go over, and it's a big investment and he is doing. And also, you know, Vice President Kamala had a big things in here, and this is a big bill that is gonna hopefully fix this crisis that we're having. So now we are in the point of what is happening, what is next in terms of maternal care. And for me, and this is the part that I put in, this is my thinking actually. For me, I think the integration, complete integration of midwives in the healthcare system, it should happen. It should happen in every single place that they offer maternal care, not only public hospitals, and including private hospitals. Every single hospital that offers maternal care, they should have a midwifery care. And no matter where it is, in rural areas and urban areas, that is the way that it should be working. If we are serious about fixing this maternal health crisis that we are happening, not only in Black communities, and also in general, that women care should be better, because the amount of C-section and of prematurity, we invest in so much money in that. Prematurity alone costs us 60 billion annually. So that alone is a lot of money that we can change in that. And not only is about the take care of the prematurity, but also has some other consequences that you can be, these babies, they're gonna need a special care and a special education. So it is, we have to be a little more serious about it. Another thing that I think we should be training multicultural midwives. That is very important to have in there. And so we should be reflecting the people that we're serving. So that way, the care should be more geared towards a specific individualized care, because that is what we really need. And as I said again, the universal midwifery care should be a mandate. And that is that for me. And here is a little picture of a women supporting women. Here I'm with two moms here. It's a beautiful event. And that is that. Thank you. And I want to point it out one thing, that tomorrow is to May 5th, the day of the International Day of the Midwife. And we following our slogan to this year is invest in midwives. We want to invest nationally, internationally, around the globe to have a better care for women. That is that. Thank you.
Thank you, Eugenia, for that amazing presentation. You have given so much information of so much value. I'd like to remind our viewers that these presentations are available after the end of the conference. So if you'd like to go back and check some of the email addresses or links that Eugenia shared, you can do so then if you missed them this time. We hope that you will stay with us and check into some of our upcoming presentations. We're here for the entire day, and we have amazing speakers all day. Thank you, attendees, and thank you, Eugenia.
Thank you.
Okay.